Good afternoon, everyone, and a very warm welcome. I am Dr. Tarinee Puri on behalf of Voice of Healthcare, and I'm here to discuss about leprosy, as today is recognized as World Leprosy Day by WHO. Leprosy continues to be burdened by pervasive stigma, and that's why we've organized this discussion to spread awareness about the associated prejudices with our partners who have been working on interventions to eliminate the disease. I feel immense pleasure to bring in great leaders who are working in the domain of leprosy eradication and elimination together on the VOH platform to conduct a session on a step closer to eradicating leprosy. Together, let's beat leprosy, supported by Rotary Club of South Delhi and Lepra. In this session, we will be discussing about causes of leprosy, creating awareness and fighting against the stigma related to leprosy. Before commencing the session, let me introduce you to our esteemed speakers of the day. Today, we have with us Mr. Deepak Kapur, who is the chairman of Rotary Club Alliance for Leprosy Control. Good afternoon, Mr. Deepak.
Good afternoon.
Thank you for joining us today.
Pleasure being here.
Then we have with us Dr. Prasant Kumar Naik, who is Chief Executive at Lepra. Good afternoon, Dr. Prasant.
Good afternoon. Good afternoon. Hi, Deepak.
Hi, Prasant. How are you?
Fine, thank
It is
you.
a pleasure having you today. Our
Thank you.
third speaker would be joining us in a while. So, to start the discussion, my first question would be to Mr. Deepak. What is the patient care model that exists in India to detect, treat, and rehabilitate leprosy patients in India?
I think the model is a little variable from place to place, state to state. However, it would be based on hospitals, dedicated hospitals with leprosy wards, detecting, more than detecting, treating patients with leprosy who come there, to find leprosy in the community. Quite often, medical camps by various NGOs and by the government are also conducted. Thirdly, there is what we call the concept of active case finding, in which government health workers and Rotary has been, along with Lepra, has been participating in these active case finding exercises conducted, for instance, by the Delhi government in northwest Delhi, where volunteers actually and health workers actually go from house to house to try and detect signs of leprosy. This is once a person is detected with leprosy, there is free treatment available. What is known as, the acronym is MDT, or multi drug treatment, which is a mixture of, not mixture, several antibiotics put together. And within approximately 2 to 3 days, the person having the MDT would become non-transmitter of the disease, which is a huge thing, because leprosy can does spread by people to people contact. So if you can get it in the early stages and control it, you have two advantages. A, um, please signal to me when I've spoken too much, because I'm tending to become a little long-winded. But there are two ways in which this can help. One would be, if you catch it early, the person doesn't have a chance to transmit it to too many people around him or her. And the second is that he or she can be immediately treated for whatever problem they have hitherto had. One slight lacuna in our system is that private hospitals are not obliged to report all cases of leprosy that they detect to the government of India. And I think this is, or the state government, this is perhaps necessary if more attention is to be paid to leprosy control in our country. Apart from this, there are once somebody has been detected, then efforts are made for ulcer management because once you have leprosy, as you know, there are a lot of ulcers that develop, especially on the feet and other parts of the body that need to be treated. And at times, reconstructive surgeries have to be conducted. For instance, in the fairly recent beautiful medical facility which has come up in West Delhi called the Indira Gandhi Hospital, with which Rotary and Lepra are in collaboration to do these reconstructive surgeries and for ulcer management. I must also point out that the NGOs did a stellar job during COVID 19 because when we were all confined to our homes, I'm talking of the city of Delhi, um, there were very few avenues for earning that many of the leprosy patients and those residing in leprosy colonies had. So, Rotary in Delhi, several clubs here in Delhi, along with clubs in Bangalore, got together with a CSR grant from a benefactor and provided free food for twice a day to all the inmates in four large leprous colonies which had leprosy patients or those suffering from leprosy as inmates for 4 months. It was important. One other thing is an effort by some NGOs, Lepra, Rotary, and the Leprosy Mission India to set up vocational training centers. This is in the pipeline as far as we are concerned in Rotary, along with the Mission India to set up a vocational training center where not only would those suffering from leprosy or their immediate family members be trained in certain special skills, but they would also, um, all efforts would be made for their placement post completion of the course. I'm sorry to have spoken for so long.
No, it was really insightful. It was a very comprehensive answer, and the efforts are commendable. Thank you so much for the information. My next question is going to be for you, Dr. Prashant. Um,
Yeah.
I would like to know your perspective on the introduction of the new treatment regimens for leprosy by the Health Ministry.
Dr. Tarinee, what uh, the regimen has been the same since 1982, as Deepak was mentioning, and this is the MDT, multi-drug therapy, and it has been there since, so it's almost 30, 40 years that it hasn't evolved anymore. So obviously, going forward, we do have research gaps, and this is a little bit and disheartening to see that leprosy, in spite of being declared as eliminated in 2005 by Government of India, still maintains a healthy numbers. Every year we get about 100,000 cases, which is about 60% of the, around 60% of the global new cases every year. And so India has to make a last push which includes what you're talking about, a new regimen of drugs or other forms of diagnosis or treatment, so that this transmission is broken and the leprosy comes under control. And that's where it has we have stuck. But I would like to take this opportunity to add to what Deepak said. The major cause is late detection, why leprosy persists. The issue of or lack of public awareness that this disease is completely curable. It's a bacterial disease, and a lot of stigma, biases, prejudices, and discrimination, resulting discriminations are to there. So, as Deepak was saying, early detection is the key, which will prevent disability. Otherwise, you end up with losing your nerve function, which leads to you not feeling any pain, and then you
Yes.
start injuring certain parts, especially feet and your fingers, again and again, and then you start losing the bones. So it's not the leprosy per se that you lose your bones and deformity happens. It's the lack of sensation in your nerves, and the result of late detection. Then currently we also lack. Which I should say that taking this opportunity, it can come in the new regiment, is the routine surveillance, continuous surveillance across wherever a case has been found or within the communities. We have to work within the current systems, health systems, to ensure there is a routine surveillance so that we are able to detect the case very early and cure it completely through the MDT which is there. So the other reason why there hasn't been a new regimen so far, unlike TB, is this has been effective. There hasn't been large scale cases of resistance or anything. So it's still effective. And going forward, some of the gaps in research we need to address.
Thank you, Dr.
Yeah.
Prashant. Um, could you also tell us about your work in India and initiatives you've undertaken to help leprosy patients and survivors?
Yeah, thank you. So we currently work, including Delhi, where Rotary is a great one of our major partners in 12 states across India. So Delhi, UP, Bihar, Jharkhand, Chhattisgarh, Odisha, MP, Rajasthan, AP, and Telangana. A bit in Maharashtra, I have started 2 years ago. So and these are endemic, and we don't cover the entire. We are concentrated, our centers are concentrated in the endemic districts, but whenever there is a campaign or active case finding, then we go to work with the government across all the districts in the states. We work from active case detection to the rehabilitation, both physical rehabilitation if there is a need of surgery otherwise, and uh, economic rehabilitation, which Deepak was referring to about the livelihoods or vocational training that they're doing, so that they have a dignified livelihood after it is cured. They are released from treatment. So we start with the community where there is element of detection of the cases, early cases, suspected cases. We refer it to the PHCs and the local hospitals where the doctor certifies that it is leprosy, and then the person is treated. If there are ulcers, the ulcers are bandaged and treated so that it heals and person is able to work. Then there is a very important element in leprosy, unlike other diseases. It's related to footwear. Footwear is not an accessory in leprosy. It's part of the treatment because it prevents the ulcers on your feet. And it is made with a very special kind of rubber sole, which is called microcellular rubber or MCR. And this is very, very essential for patients who have uh, ulcers on their feet after being cured from leprosy. And then other element is addressing the stigma and discrimination through awareness, working in the communities, training, working with the ASA workers who are the the face of Indian health systems right there at the grassroots, uh, telling them all about leprosy and how it can be handled and how to find a suspected case and immediately refer it, because it's all about finding the preventing deformities. So, yeah, this is how we work, basically from early case detection with the community to treatment to surgeries to socioeconomic rehabilitations to have a dignified life within the society and get back to the society. There is another element which is, I think, very, very positive for Government of India and us, all of us, is now many of the affected patients, they stay with their families or with their communities and their jobs. Earlier, because of stigma and misunderstanding and prejudices, they were put by the family in colonies. So there are about 1,000 colonies in India, leprosy colonies, including in Delhi, where you are working together with Rotary. So the people no longer are throwing their, because there is certain level of, quite a high level of understanding that this is a bacterial disease and it's curable and it's no longer transmittable within the families once the medicine has been given. So people are staying and they're maintaining their livelihood. They're no longer going and begging as the only means of livelihood, and they're continuing with their day-to-day life, and that's a very positive thing. Thank you, Tarini.
No, that the initiatives you spoke about, they were really inspirational. It's really good to know that so many things are being done to actually work on leprosy and the stigmas associated with it. Thank you so much, Dr. Prashant. Um, I would now like to address my next question to Mr. Deepak. So, could you tell us about the areas Rotary is working on to support the leprosy patients and their families in India?
I think we've touched upon most of the activities. However, if I were to give you bullet points,
Yeah.
I would say awareness creation, training of medical and paramedical personnel to be able to detect leprosy. Third would be active case finding. The fourth would be palliative care, which would include ulcer management, which would include provision of special shoes that Prashant just spoke about. It would also include reconstructive surgery, which I had mentioned earlier, where it is necessary. For this, we have two special vans in Delhi, fully equipped, and with personnel from our partners, Lepra. These are going from colony to colony. You'd perhaps be surprised to know that there are over 40 colonies trans Yamuna, that is in the Tahirpur area, 40 colonies where patients of leprosy live. So these vans go there and provide whatever palliative relief they can to those suffering from leprosy there. And apart from this, as I mentioned, this major facility in the Indira Gandhi Hospital in West Delhi and Gobind Singh Hospital, where Lepra has done a lot of work. These are special centers where all this can be done. Again, I had referred to this earlier with the help from Lepra and the Leprosy Mission of India, which has this beautiful building in Noida. Um, Rotary is in advanced discussions with them to set up a vocational training center where leprosy patients or their family members would be trained in vocational skills like um, uh, 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 without going into details, to become beauticians or to become um, IT adept at various things that can be done with information technology. For instance, uh, tally accounting packages. That's just one example that I'm giving you. It could be TP work, basic proficiency in word processing and in spreadsheets, which would help them earn a living, but that's just not at all. The
Hmm.
basic idea is to follow it up and provide them
Hmm.
with jobs for this.
Hmm.
I
Um,
might, I'm
hmm.
sorry, I might mention here, I don't know how familiar your viewers are with what Rotary is.
Hmm.
Rotary is an international organization which was set up in 1905 with just four members.
Hmm.
Today, it exists in over 200 countries across the world with 1.3 million Rotarians. And when you add their family members to it, it's a huge volunteer force. And it's obviously only voluntary work that is being done with them. We, our flagship program was and continues to be polio eradication, of
Hmm.
which I am the Rotary's chair for India. And we have managed to get rid of polio from India.
Hmm.
The last case of polio in India was on the 13th of January 2011. Since then, we've had no polio. And this year in March, in fact, on the 27th of March, we would be celebrating 10 years of certification by WHO of India as a polio free country. It's a big moment in our history.
Yeah.
The reason I'm mentioning polio so much is because the
Hmm.
learnings from what we did in polio
Hmm.
eradication are what we are seeking to apply to other things. They were applied during COVID-19 outbreak,
Hmm. Yes.
also used for measles and rubella campaign, and
Hmm.
now we are hoping to translate them into action in the field of leprosy control as well.
So, as you already mentioned that about your efforts regarding polio elimination from India and your efforts about the fight against COVID-19, would you and you did touch upon the challenges faced on ground for leprosy elimination, but would you like to elaborate the challenges on ground that need to be solved in case of leprosy elimination?
Most certainly. The first would, of course, as Prashant said, be awareness creation.
Hmm.
Awareness creation would involve and does involve very strong advocacy in three areas, three
Mm-hmm.
segments, if I may put it, with the political leadership and the government, with
Mm-hmm.
the bureaucrats handling
Mm-hmm.
this issue, and thirdly, with religious leaders to ensure that it is accepted in society without um, an issue. So
Hmm.
advocacy would be one. The
Mm-hmm.
second would be surveillance and training,
Hmm.
teaching paramedical staff and even medical staff at times
Mm-hmm.
how to detect signs of leprosy
Yes.
and to then be able to refer them to the right medical facility.
Hmm.
The third is to face, again, Prashant touched upon this, the
Hmm.
stigma
Yes.
that was uh, and is to some
Hmm.
extent, maybe to a
Hmm.
slightly lesser extent, but the
Hmm.
stigma that is attached to a patient of leprosy. Let me
Hmm.
tell you about a personal experience I had in the Mother Teresa home, where which is for leprosy patients, and
Okay.
with a
Yes.
large number of inmates, a very large facility doing excellent work, where
Hmm.
Puri has been fortunate in providing them with lots of palliative care and
Hmm.
also solar panels so that their electricity bills were halved and now are practically negligible. So um, we went there to a function where we were donating some wheelchairs for those afflicted by leprosy, and we
Hmm.
saw this strikingly good looking girl, looking a lot like you. And
Thank you.
I mean, is very nice looking girl, um, who was sitting there quite demurely wearing a sari, and
Mm-hmm.
she was asked to come to the dais and sing a song. And
Okay.
she sang in a beautifully melodious voice, really well, and quite a touching song. And then she lifted her sari and showed that she did not have any fingers on one hand. She was a person with leprosy who had been detected too late. And the story she told was harrowing. She came from a good middle class family, good in terms of economic terms. Um, but her family, the moment they got to know that she had leprosy, turned her out of the house. She was left to fend for herself on the streets of Delhi, where she was then picked up by the Mother Teresa Home Sisters and found some place there. So it was quite horrendous that even today we still have this kind of ostracization of those with leprosy. If she had been treated with the MDT, she would have been not a transmitter at all. And eventually that happened. But by then, she'd already suffered whatever damages there were. And some of the archaic laws that we have that need to be addressed. I was in the speaking to uh, a member of the National Human Rights Commission on leprosy, and gave me a whole list of laws that they are fighting against the NHRC to have them repealed because these date back to the colonial times or some not dating as far back as that, but several decades, which are completely unfriendly to leprosy patients and need to be repealed at the very earliest. So that is another front to be working on. But the most important thing I believe is closing the gap between demand and supply. There is free supply of multi drug treatment, MDT, that we spoke of, to all those it at various designated medical centers and hospitals. But there is not enough of an uptake from the beneficiaries because of stigma, be it because of lack of awareness, be it because of late detection, whatever be the cause. We have to try and bridge this gap between demand and supply, which is what happened again in polio. It's a learning from polio, where the government of India was providing free vaccine, free oral vaccine, OPV drops, everyone. And there wasn't enough of an uptake until um, a lot of efforts were put into this with through advocacy, through all kinds of measures, be it miking, posters, banners, hoardings, be it street plays, all kinds of stuff that is done, and all that needs to be done for leprosy as well. And then today, every mother or father would go to a primary health center and demand polio drops, or now they use the IPV, which is the inactivated vaccine, which is injectable. They, I have seen myself, the beneficiaries, the parents of the children, insisting upon their child getting the immunization against polio. So that's what we have to work towards, to generate demand and make this into people's movement. All sections of society have to get together. It can't be just the government. It cannot be just the bureaucrats. It has to be the whole community, whole society, which has to get together. And that's when we'll be able to control leprosy.
Thank you so much, Mr. Deepak. That was your personal stories were really touching, and I believe they really emphasize on how important awareness in leprosy is, and definitely how important it is to have a collective effort to spread this awareness to eradicate it. Thank you so much. Um, My next question would be to Mr. Prashant.
Yeah.
So, as you already spoke about the societal attitudes towards leprosy, what further measures do you think are essential to overcoming the prevailing misconceptions?
Thank you. So, one of the important one is awareness, awareness, awareness. So we need to start from the very beginning, right? If the with the support from the government or the local authorities, if we can put it into the curriculum of a class one or primary school, and there we mention some of the important messages, top line messages that leprosy is completely curable, it's a bacterial disease. It's the drugs are available free of cost, and so not only the child or the teachers, but also the parents, the mother who takes care of the initial days of education for the child in the class one or class two will also know, and that will go a huge distance. The other important bit is bringing in our the local representatives, people's representatives, Panchayati Raj leaders in the ward, in the villages, in the sarpanches and all. They need to be made aware. In addition to what Deepak was mentioning about the religious leaders, so these Panchayati Raj leaders would form a great core to take these messages across their constituencies and people that are working in different villages. And the other one I feel is the adequate resource allocation. So it includes both financial and human resource. Human resource because now it's no longer taught in the medical institutions. So a lot of these fresh medical professionals are not aware of detecting the leprosy, and that leads to a lot of other implications, including cost, in order to identify. And then somebody probably might end up with some deformity if it is delayed. So, and then that training beyond medical officers down to the grassroots, like I was talking to you about ASA. So these ASAs are not only looking at the uh, different diseases, but they are a very important social networker because they are from the village. They know almost all the households in the that they are allotted to, and then so if they are aware and they know all about leprosy, then they will make a difference. But I have to say that many of the ASAs themselves have prejudices and biases. And then increasing the number of female health workers who frontline workers who would be able to detect, because leprosy as such is completely painless, so nobody realizes that I have a something that I have a condition or I need to go to the doctor, so they don't go because it's painless. And then there are some signs and symptoms. One of them is a light patch, and because we are covered with clothes and all, it's very difficult to see if there is a patch or not. And if it is a male worker, he immediately loses the access to most of the females if patients if they are showing some signs. So that is why we need to increase these frontline workers, even if they are just volunteers or community workers, to train them to look at the early signs and symptoms of leprosy and bring it to the ASA or to the local healthcare facility, and that will make a big difference. And so, yeah, in the community, we have to take uh, support of the panchayati, the elected representatives or the village representatives, the religious leaders, the elders, the teachers, the retired, or other influencers within the village that we have in India, and that will help us a lot. It is moving, but it's moving very slowly. But that's where if we focus a little bit, awareness can be very helpful to controlling the leprosy.
Okay. Thank you, Dr. Prashant. Now, before we conclude the session, I would I would request our speakers to add a note for our audience about regarding leprosy awareness, something that you because both our speakers have worked in leprosy and they have their own stories. So if they had something that they would want to tell our viewers, I would request them now to please do that.
Well, I would
Will,
say that,
uh,
again, reiterating what I said earlier
hmm,
about creating awareness,
hmm,
please contact people in your neighborhood, the domestic staff working for you. If you run an industry, industrial workers, if have little pamphlets which can be taken out on a photocopier, we'll be happy to provide whatever literature we have. I'm sure Lepra would be equally happy to provide you with the excellent literature that they have developed, just
hmm.
to educate people about the signs and symptoms of leprosy, and that early detection is the key, and that free treatment is available.
Thank you,
Thank
Deepak. So from my side, I would definitely like like the support of you, Dr. Tarini, and others in the media, both social media and otherwise, that leprosy is completely curable, and the treatment is free in all the
hmm,
primary health centers of the government. And
hmm,
we should come out of self stigma. There is stigma, external stigma from the society and others, but I would like to appeal to everyone that if you see a sign of a patch or something that is related to leprosy, please come out of self stigma and go. It's a
hmm,
bacterial disease. So
hmm.
the other is to you and your community of media persons to pass these messages as much as possible, as widely as possible, and that would help us a lot. We can only
Hmm.
do so much, not very much, that is, but India is a huge country, so we need to take help of everybody in this. Thank you.
So now I'd like to thank our speakers for for spending this time to talk about leprosy on this day, to talk about awareness, to tell us about initiatives, the hurdles, and the challenges. Thank you so much for your time. Unfortunately, our third speaker, Dr. Sudarsan, could not join us today. But this session was really informative, insightful, and touching. Thank you so much. And I'd like to thank Mr. Deepak, Dr. Prasant. I'd also like to thank our audience today. I'd like to thank Rotary Club and Lepra for supporting us in this initiative. And once again, each of our panelists for spending time with us. And please have a good day. Thank you.
Thank you.
Thank you.
Thank you.
Thank
Thank
you.
you.
Thank you.